Good evening, guys. I have discussion C for you. Now we are discussing how CMS is reportedly exploring making Medicare Advantage the default for new beneficiaries. Auto enrollment, a move that could shift cost networks, and benefits toward private plans while preserving an opt-out path. Confirm details with trusted news or CMS resources. Okay, guys. Now, question: what if the government automatically put you into a private Medicare plan? Would your health care bill go up or down? Why it matters. Auto enrollment into Medicare Advantage would change the default choice for millions of seniors. And could alter premiums, out of pocket exposure, private provider access, and drug coverage. Key facts to state brief sourced. CMS is considering models to auto enroll beneficiaries into Medicare Advantage or ACOs. Current default original fee for service. Medicare is the default for those who don't choose. Over half of seniors already choose Medicare Advantage. Officials say beneficiaries could still opt out or choose another plan. The proposal aligns with projected Project 2025 recommendations to make MA the default. The plan has drawn scrutiny and debate in media and policy circles. What this could mean for listeners: concise bullets, cost potential for lower adverse premiums, but higher out of pocket limits, prior authorizations, and narrower drug formularies, depending on plan design. Provider access, network restrictions could limit which doctors/hospitals are covered. Choice and switching. Auto enrollment may increase interior. Some seniors might remain in plans that are not optimal for them. Equity concerns. Rural beneficiaries and those with complex needs may be disproportionately affected. Interview targets and questions. Guests. Medicare policy expert, consumer advocate, Medicare Advantage plan rep, practicing geriatrician. Questions. Just 1 second, guys. How would the auto enrollment change the enrollment process and timelines? What trade offs should seniors weigh between premiums and out of pocket risks? How would this affect community continuity of care for patients with chronic conditions? What's being proposed? 5 minutes. Cite CMS reporting, healthcare finance news. Risks, trade-offs, and source to cite risks of reduced provider choice and increased utilization controls. Potential potential for confusion and inter among beneficiaries. Primary sources to link in show notes. Just a second, guys. Call to action for encourage seniors to review their Medicare options during enrollment periods and consult a trusted counselor ship before accepting any default plan. CMS is reportedly weighing a policy to automatically enroll some new beneficiaries into Medicare Advantage plans. This could shift defaults towards private plans while preserving opt out rights. Give me 1 second, folks. No. Imagine turning imagine turning 65 and being placed into private Medicare plan. Unless you actively opt out, what would that mean for your care and cost? Why it matters. Auto enrollment changes the default choice for millions and raises stakes around premiums, networks, and supplemental coverage. Key facts to state: CMS is considering, CMS staff have discussed models to automatically enroll beneficiaries into Medicare Advantage or ACOs rather than leaving them in original Medicare by default. Current enrollment landscape: over half of Medicare beneficiaries already choose Medicare Advantage. Existing authority and pilots. CMS has an existing default enrollment mechanism for a certain Medicaid to Medicare transitions and has approved organizations to use it. Broader auto enrollment would be expansion. Enrollment rules remain important. Medicare.gov outlines strict enrollment periods and rights to switch at any auto enrollment proposal would interact with those rules. What this could mean for listeners: cost lower or zero premium are common in MA plans, but plans can have higher out-of-pocket limits, prior authorization, and narrower formulas. Access network restrictions may limit which doctors, hospitals are covered. Continuity of care could be affected. Choice friction. Auto enrollment increases interior. Many beneficiaries may remain in a default plan even if a different option suits them better. Equity concern. Rural, rural, rural beneficiaries and those with complex needs may face disproportionate harms from narrower networks or utilization controls. Give me 1 second. What trade-offs should seniors weigh between premiums and out-of-pocket risks? How would this affect access to specialists and continuity of care? CMS guidance on MA enrollment and default enrollment data. Call to actions. Review options during enrollment periods and contact local SHIP counselor before accepting any default plan. Okay, guys, there's a reason why I did this show, so that you guys had a heads up what's coming down the pike in the future for people, elderly folks, disabled folks. That's why I did tonight's show. So I hope this gave some people some information they really need. For now, Gator Wellness, take care, folks.